there are two very large clinical trials ongoing. One trial in countries like the UK, Brazil, South Africa, and a couple of other countries. And that trial is well on its way. And we are expecting clinical results at the end of the year. There's another very large trial ongoing in the United States, and where we have restarted the trial now almost 2 weeks ago. And that will take a little bit longer. But all in all, we are expecting the first clinical data of our first trial at the end of the year. The safety of every medicine, including a vaccine, is our number one priority. And the fact that we are looking with a magnifying glass about how the vaccine is performing in the real world is, I think, a testimony of how we are working as a company. But equally, we need to realize that for good reasons, the regulatory bodies are very close to this as well. I'm not going to comment on individual cases. There are specific reasons for that, patient privacy as well as the trial integrity. But all in all, of course, we will do everything in order to make sure that if the regulators are deciding that the vaccine is safe and effective, that we will continue to look into this. I think there's a shared responsibility of governments across the world and the industry in order to be as transparent as possible regarding the safety and potential side effects. We know that vaccines have side effects. You will have some pain in your arm. Some patients will develop a mild fever. And I think it's very important that, yes, we will explain that to societies in the world. But equally, of course, very important is that we will show the advantage of getting vaccinated. I always said that during the pandemic, AstraZeneca will provide the vaccine at no profit. But equally for low and middle income countries, we have clearly said that AstraZeneca will supply even after the pandemic those countries at a no profit pledge. And I think it's important. Anyway, the vaccine has a relatively low cost. It's a couple of dollars. So whatever is going to happen, we are extremely committed in order to make sure that not only the rich countries, but also, once again, the low and middle income countries can afford to have this vaccine in order to protect